Okay, so this video is going to cover the radius and the ulna. So the radius, there's not a whole lot of features, but the head of the radius is here. And then this constriction point is the neck, so the head, the neck. This raised area, which is actually really important, is the radial tuberosity. This is where the biceps brachii inserts, or at least most of that muscle inserts on the tuberosity of the radius or the radial tuberosity. This is the shaft of the radius. So these features are on the proximal end of the radius, and then we come to the end or the distal end of the radius, and this portion of the radius, which is a little bit lower than this side on the ulna, is the styloid process of the radius. Okay, styloid process of the radius. And I'll talk a little bit about this end of the radius when I talk about the joint here in another video. Now, the ulna articulates with the trochlea here on the humerus, and it also has a joint between there's a joint between the radius and the ulna. But here, between these 2 points on the ulna side, there's a radial notch right here, radial notch, where the head of the radius kind of sits in. And then really there's not a whole lot that I can point out on the ulna bone, but then here on the distal end of the ulna, just like the styloid of the radius has a styloid process, the ulna also has a styloid process. Just to point something out while I'm thinking about it, between these 2 bones, there's a membrane or connective tissue called the interosseous, meaning between 2 bones, interosseous membrane.